Hey everyone, welcome back for another deep dive.
Today, we're tackling something that's making waves in Delhi's healthcare scene, gestational diabetes. You've given us the new Standard Operating Procedures, or SOPs, for GDM, fresh from the Directorate of Family Welfare, and we're here to break it all down for you.
It's a big document.
But it really reflects a proactive push for better GDM care across the board.
Right off the bat, these new SOPs feel like a big deal, wouldn't you say?
Well, it's got healthcare workers and, more importantly, expectant mothers buzzing about these changes.
The buzz is warranted. This is about recognizing that gestational diabetes is a serious public health concern.
Especially in a city like Delhi.
We're talking about a condition that affects a substantial number of pregnancies and the implications if not managed properly.
Well, they are significant for both the mother and child. Okay, so let's dive into those implications a bit. You're saying this document signals that Delhi's taking a more serious stance on GDM.
Absolutely. The Directorate of Family Welfare is aiming to standardize GDM care.
That means whether you're getting care at the primary, secondary, or tertiary level, the goal is consistent, high-quality management for every expectant mother.
That's huge.
Consistent care can make all the difference.
But before we get ahead of ourselves, let's go back to the beginning. When it comes to diagnosing GDM, what changes should healthcare workers be most aware of?
One of the most interesting aspects of these SOPs is the introduction of DPSI rooms. Now, you might be wondering, what in the world is a DPSI room?
You know me, I love a good acronym breakdown.
It stands for Diabetes in Pregnancy Study Group of India, and essentially it's a dedicated space within healthcare facilities specifically designed for GDM screening and diagnosis,
The beauty of this is that it centralizes the process.
making it less complicated for expectant mothers.
So instead of multiple appointments, different tests, the DPSI room streamlines everything in one place.
Efficient and user-friendly, I like it. But what about the actual testing? What can you tell us about that?
Here's where it gets really interesting. Forget fasting.
The SOPs recommend using a single test, the 75G oral glucose load for both screening and diagnosing GDM, and it doesn't require fasting.
That's a common misconception, and these SOPs are directly addressing it.
That's great news for expectant mothers. Less time worrying about fasting, more time focusing on a healthy pregnancy.
So we've got a dedicated space for testing, a more streamlined process, and a single test that doesn't require fasting. That's already a big step in the right direction. But I know from the document that these SOPs go beyond just diagnosis, right?
Exactly. They delve deep into a comprehensive management plan for women diagnosed with GDM.
Which is crucial. What good is a diagnosis without a plan?
So let's unpack that plan. Where do these new SOPs direct healthcare providers once a diagnosis is made?
The SOPs emphasize a multi-pronged approach, really highlighting that managing GDM is not a one-size-fits-all. They break it down into three main pillars: maternal nutrition therapy, which we often call MNT, pharmacotherapy, and clear referral protocols for specialized care.
Okay, let's break that down, starting with MNT. What does a healthy diet look like for a woman with GDM according to these new guidelines?
These SOPs move away from that old generic advice of eat this, not that.
Instead, there's a big emphasis on individualized care. We're talking calorie plans tailored to a woman's pre-pregnancy BMI and her activity levels.
It's about working with her individual needs and lifestyle.
So what you're saying is these SOPs ditch the generic diet advice and focus on personalized plans based on an individual's needs.
That's fantastic.
Exactly. And to help healthcare providers implement these personalized plans, the SOPs include detailed meal plans and food exchange lists.
It's about giving healthcare providers the tools they need to help each woman make sustainable changes.
This is really sounding like a positive shift toward a more holistic approach to managing GDM. It really does feel like a breath of fresh air compared to the old way of doing things.
But we know diet is only one piece of the puzzle.
What about pharmacotherapy? When do medications like metformin or even insulin enter the conversation?
That's a question these SOPs address head-on.
You're right, sometimes dietary changes alone aren't enough.
So if a woman is diligently following her MNT plan, and we're still not seeing the desired blood sugar control,
That's when metformin comes into play.
it's a medication that helps the body use insulin more effectively.
It's like giving the body a little boost in the right direction.
Exactly.
Now, if metformin isn't appropriate, perhaps due to other health factors or if it simply hasn't been effective.
Then insulin therapy might be recommended.
And of course, in cases of more severe GDM, insulin would likely be part of the management plan from the get-go.
So it's all about assessing the individual's needs and then determining the most appropriate course of action.
But I'm sure there are also those situations where a woman might need more specialized care, than what's typically provided at the primary care level.
Yeah, you're absolutely right.
The SOPs are very clear about when a referral to an endocrinologist or physician is necessary.
For example, if those blood sugar levels remain stubbornly high despite the MNT and medication, that's a red flag.
Or if complications arise during the pregnancy, like preeclampsia or fetal growth restriction,
It's time to bring in those specialists.
it makes sense to have that extra layer of support when things get complex.
And what about the baby's growth?
You mentioned fetal growth restriction, but what about the opposite?
Babies who are measuring large.
That's called macrosomia.
And it's another situation where these SOPs provide really important guidance.
They actually include a fascinating statistic.
If the estimated weight of the baby, and remember this is an estimate, exceeds a certain threshold and the mother has diabetes, the SOPs recommend considering an elective C-section at 39 weeks.
Wow, that's getting into some pretty specific recommendations.
It seems like they're really trying to equip healthcare providers with a plan for every scenario.
Precisely.
They are equipping them, but it's also about making sure those decisions are made in partnership with the expected mother.
Considering all the individual factors at play,
I love that you highlighted that. Shared decision-making is so crucial.
especially when it comes to something as important as childbirth.
Now, we've talked a lot about managing GDM throughout the pregnancy.
But as we know, this journey doesn't end at delivery, right?
Absolutely not.
And thankfully, these new SOPs recognize that.
So let's turn our attention to life after delivery.
What does postpartum care look like for women who have been diagnosed with GDM, according to these guidelines?
The SOPs emphasize the importance of long-term monitoring.
They don't want women just slipping through the cracks after they've given birth.
A key part of that monitoring is the postpartum OGTT, which stands for Oral Glucose Tolerance Test.
It's done at 6 weeks postpartum to check if blood sugar levels have returned to a normal range.
So a 6-week follow-up appointment, that's one for the calendar.
What else is on the checklist for those postpartum appointments?
Contraception counseling is another essential piece.
And the SOPs make it super practical for healthcare providers.
They actually include a visual guide to different contraceptive options that healthcare workers can use when discussing family planning with women who have had GDM.
That's so smart.
Because certain methods might be riskier than others for women who've had GDM, right?
Exactly.
And having that visual aid can make those conversations much easier and more effective.
But beyond those specific tests and consultations, there's another element of postpartum care that these SOPs emphasize, and that's the role of community health workers.
You might know them as AJAPAs.
AJAFs do incredible work.
It seems like they're involved in almost every aspect of community health in India.
What's their role specifically when it comes to women who've had GDM?
They're like the bridge between those formal healthcare settings and the women back in their communities.
They're the ones providing that ongoing support, reinforcing those healthy lifestyle changes, reminding women about their postpartum checkups, and just being a friendly face and a listening ear.
It's like having a health advocate right there in your community.
Someone who understands the unique challenges women face after a GDM diagnosis.
Exactly. And that kind of support can make a world of difference.
Especially when you consider the long-term health implications of GDM.
These SOPs don't shy away from that conversation.
And that's so important. Let's talk about those long-term risks. What should women be aware of, and how can they be proactive about their health in the years after having GDM?
One of the biggest concerns is the significantly increased risk of developing type 2 diabetes later in life.
We're talking about a 10-fold increase compared to women who didn't have GDM.
Tenfold. That's a scary thought.
It is, and it's not just diabetes.
Women with a history of GDM also face a higher risk of cardiovascular disease, metabolic syndrome.
A whole range of conditions that impact long-term health.
Okay, knowing that, what can women do? It's easy to feel overwhelmed by those statistics.
It's about empowerment, not fear-mongering. And the good news is that many of the lifestyle changes that help manage GDM during pregnancy also have a huge impact on preventing or delaying those conditions later in life.
So maintaining a healthy weight, eating a balanced diet, staying physically active.
These are all things women can do to take control of their health.
Exactly. And these are things healthcare providers should be emphasizing throughout the entire journey.
From that initial GDM diagnosis through those postpartum appointments and beyond.
It's about establishing healthy habits for life, not just for 9 months.
It sounds like these SOPs are really encouraging a more holistic and long-term approach to GDM care.
It's not just about managing a condition during pregnancy. It's about empowering women to prioritize their health for years to come.
You've hit the nail on the head. This document provides a really solid roadmap for healthcare providers, but it's just the beginning.
What additional resources or support systems could empower women diagnosed with GDM to take control of their health and advocate for themselves and their babies?
That's a powerful question to leave our listeners with today. It's a reminder that this is an ongoing conversation.
And there's always more to learn and do to improve GDM care. So, if you're facing a GDM diagnosis, remember that knowledge is power.
Talk to your healthcare providers, ask questions, and be your own advocate. And as always, thank you for joining us for another deep dive into the knowledge that matters most to you.